Good morning, everyone. My study is prevalence of chronic allergic conjunctivitis in pterygium cases. Pterygium is a benign fibrovascular growth of conjunctival tissue extending onto the cornea, often associated with UV exposure, dust, and inflammation. Chronic allergic conjunctivitis is long-term inflammation of conjunctiva due to allergen causing itching, redness, tearing, and papillary reaction. Rationally is chronic allergic conjunctivitis may promote pterygium via fibrovascular changes. Aim of this study is to evaluate the association between pre-existing chronic allergic conjunctivitis and pathogenesis of pterygium. This is a retrospective study, duration 1 year, done at Regional Institute of Ophthalmology. Sample size is 76. More than 18 years of the patient and patient presenting with pterygium willing to participate were included in the study. Ocular surgery, trauma, other ocular pathology, unreliable history excluded from the study. Patients were surveyed via a structured questionnaire to assess history of chronic allergic conjunctivitis, including symptom, duration, and specific trigger. SPSS software version 22 was used for the data analysis. 40 patients were male and 36 female. Mean age of the presentation was 42.2 plus minus 13.8 years. 65% patients were from the rural population and 35% patients were from the urban population. Out of 76 patients, 23 patients gave the history of chronic allergic conjunctivitis. Prevalence of chronic allergic conjunctivitis in pterygium is 30.26% in this study. Type of allergen specified by the patient was 55% patient, 53% patient did not give any particular allergen history. 30% patients were having dust allergy, 9% VKC, and 9% photoallergy. And this is the chart shows outdoor exposure analysis. 68% patients were having no outdoor exposure in patients of chronic allergic conjunctivitis with pterygium. Patient with chronic allergic conjunctivitis presented 100% patient of chronic allergic conjunctivitis presented bilateral pterygium. The various previous study has found that the risk factor fall in 3 categories: demography, lifestyle, and environmental factor. Most common is sunlight exposure. Similar to previous studies, rural population and outdoor exposure occupation shows a higher risk for pterygium, but a significant 68% patient with pterygium and chronic allergic conjunctivitis reported no outdoor exposure. Challenges typical UV exposure risk, suggest indoor allergen or other factor at play. In current study, 30.26% prevalence of chronic allergic conjunctivitis support a link between chronic allergic conjunctivitis and pterygium. Study by Aini et al. In 2025 and 23, they have concluded in their study that ocular and systemic allergy increases pterygium risk, and chronic allergic conjunctivitis is an independent risk factor for the development of pterygium. This is the illustration of immune pathway from chronic allergic conjunctivitis to pterygium. After allergen exposure, activation of eosinophil and mast cell causes chronic ocular surface damage, which causes matrix remodeling and angiogenesis, which can develop pterygium. Retrospective design, small sample size, and potential recall bias is the limitation of this study. Conclusion of this study is pre-existing chronic allergic conjunctivitis prevalence in pterygium is notable, warranting further investigation into allergic conjunctivitis as a risk factor for pterygium. These are the references. Thank you.